Good morning and welcome back to our Friday video series. Over the previous 3 videos, including today now our 4th, we're going to attempt to answer questions you have about what's going on with healthcare, how it impacts the Washington health system, and what's going on with the coronavirus. My name's Brook. I'm the President and CEO of the Washington Health System. Happy to be here to help answer some of those questions. One of the questions we've gotten recently is which of our services are still open? And it's actually easier to answer which services are closed. Today, because of the coronavirus and the governor's order to shut down all non-emergent and urgent life-sustaining services, what's completely closed would be the Children's Therapy Center, the Wilfred R. Cameron Wellness Center, our outpatient rehab, OT, and speech, pulmonary rehab, and cardiac rehab. Otherwise, every department and every service is open, although not operating at 100%. We're only taking care of urgent and emergent cases. Another question we've gotten is what type of telemedicine options do we have available? And frankly, within the last 2 or 3 weeks, we've implemented many of these that we didn't have before. We've really done a wonderful job between our clinical team, our IT folks. Getting that all set up in such a short time period was really remarkable. And so we're doing now telemedicine between our hospitals. We're doing telemedicine within the hospitals, sometimes doctor to doctor, but even the clinical staff to the patient, so that they don't have to go into the room and be potentially exposed. But what I wanted to talk about today was our telemedicine, or what we're calling televisits, between patients and physicians in our physician offices. So over the last couple of weeks, we now have televisits set up for all of our physician offices in the WPG and within the Washington Hospital Residency Program for all the primary care offices. That includes family medicine, pediatrics, and internal med. In addition to that, we have it set up in a number of our specialty clinics. Those will be OBGYN, nephrology, cardiology, and behavioral health, with more to come. Now, these are secure two-way video visits between you and your provider to take care of your healthcare need. If you're interested in this or a regular appointment, call your doctor's office to set up an appointment, talk with the clinical team on that end, and they'll determine whether or not you truly need an inpatient visit or whether or not they can take care of you with a televisit. If you'd like to learn more, go to whs.org and click on My WHS. One of the other questions we've gotten this week, in the past weeks as well, is what's going on with COVID testing? How many supplies do we have? How can you get it? How long do the results take, etc.? There's a lot of questions around that, and I want to attempt to answer that today. So early in this crisis, in mid-March, we had very few test samples. I think we had like 12 test kits to use on patients. We were told to use them very sparingly, and they had to go to the state lab. That process didn't work very well, admittedly. Sometimes the results took at least a week, if not more, to get back. Thankfully, pretty quickly, by mid to late March, Quest Lab started running specimens as well, and we started getting more test kits. Now, early on, those test kits were being sent to Virginia. The Quest Lab in Virginia started to get overwhelmed with samples. Then they started sending our samples out to California. And during that time period, the test results were coming back somewhere between 5 to 12 days, which is not very helpful if you're waiting for those results. Thankfully, by the end of March, Quest started sending our samples and they set up testing in the Pittsburgh lab. And then we saw the turnaround time for those results go from 2 weeks down to a week. And today we're consistently getting them back in 24 to 36 hours. Now, in addition to that, about a week and a half ago, we got the capability to run and do COVID testing in our own lab here at Washington Health System. The problem with that is we have very limited supplies. So we can run the test about once a day. It takes about 3 hours to get the results when we do it, but we don't have enough sample test kits to run on every single patient. So we're prioritizing those. We're using those in-house test kits for patients who are either admitted to one of our hospitals or have come to the ED and are going to be admitted. You might ask, why only those patients? And the reason is to conserve PPE. If we can get the test result back quickly and we can determine whether the person is positive or negative, that helps determine how we're going to care for that patient while they're here in our building. And so if they end up being negative, we can take them out of the isolation room and we can have the staff stop using PPE, which is a critical asset, as you know, at this time, while they're taking care of those patients. Other patients who show up at the ED who are not going to be admitted, we'll send that test sample, if we do a COVID test, to Quest, because we'll get those results in about 24 hours. So we're being very careful, watching our test supplies every single day and making decisions about where best to use that, how and when. Now, we hope to get more test kits, more samples to do specimens in the next week, and we think we're going to start doing precautionary testing on pregnant mothers who are coming in for scheduled C-sections or inductions. That way we can find out whether those mothers are positive before they deliver their baby and make sure that we care for that infant during that critical moment at delivery. So that's our next step. After that, we're considering doing proactive testing on pre-surgical patients. I don't know if we're going to do that for sure. That's what we're talking about. It all depends on whether or not we see a surge in coronavirus patients and or how the supplies for those test kits continue to flow into the organization. One of the other things I wanted to mention today and just take a few moments time is just be thankful for all the collaboration we've gotten across the community. And I want to start with the Washington County Chamber of Commerce, the Peters Chamber, the Greene County Chamber for all of their support in helping get the word out. They've been doing stuff about billboards, webinars, social media, all trying to get our information out to help the community stay safe and deliver our message. I'm really thankful to all of them. In addition, I want to make sure we take some time to thank the Washington and Greene County Commissioners, along with our state and federal legislators. Every one of them have been available when we called. They've helped to answer questions. They've been helpful in getting us resources. And at times, we've tried to be a resource for them as well and answer their questions. And so very thankful to all of those folks who've been willing to help us out and have over the last month. Another question we've gotten here just recently is, what's come of the stimulus package? And so we all know that the CARES Act was passed. In that, there was $100 billion set aside for hospitals, healthcare organizations, and physicians. And about $30 billion of that was distributed last week, Thursday and Friday, and we did in fact get some of that money. Unfortunately for us and all other organizations in the Pittsburgh market, the final calculation for how organizations got that money was based on fee-for-service traditional Medicare. And in the Pittsburgh market, we have very little of that. Most of the Medicare in this area is what they call managed Medicare or Medicare Advantage. So that makes up almost 70% of all of our Medicare. And the federal government did not include that type of Medicare in this calculation. So we did get money with that $30 billion distribution last week. Our share of it was about 70% less than a similar sized organization in other parts of the country, because Pittsburgh's unique in the fact that we have so much managed Medicare. So it was disappointing to get a lower amount than we were anticipated or what we thought was fair, but very thankful for everything we do get, because every nickel and dime and dollar counts at this point. Whether we got the amount we got or whether we had gotten something larger, it wasn't going to be enough to cover the losses we've experienced so far because of COVID-19 or what we're going to experience going forward. But either way, I'm appreciative of all the help we can get. Now, last week I talked about the governor's order in regard to inventorying PPE and their ability to commandeer that. We've complied with that order. This week, the governor signed another order that's due to take effect this Sunday, April 19th at 8 p.m. Now, this order recommends all Pennsylvanians and citizens wear a mask anytime they leave their home and have it on 100% of the time. And so I would ask you to comply with that recommendation. But there's a mandate in this new order that says essential businesses that are open are required to turn customers away who show up at their premises without a mask on. Now, that's going to be very difficult for us. As a healthcare organization, we want and try to care for everyone who comes to our doors. We don't want to turn anyone away. We also do not have enough stock and supply to be the vendor or the provider of PPE, masks, to everybody in the community. And so we're asking you and we're imploring you, please, when you come to our facility starting Monday, bring and wear a mask. And that includes all facilities, not just the hospitals. That'd be physician offices, diagnostic clinics, outpatient lab tests, you name it. Anything we have open, please come to our facilities with a mask and have it on. For those patients who legitimately don't have a mask, I'm hoping we'll be able to help them out, but please don't come here expecting us to be your source of masks. We just don't have enough equipment and supplies for that. We need those critical PPE elements to protect our own employees, and we need to make sure they're protected so they're here to take care and protect you. So more to come on that, but that's being initiated this Monday, April 19th. Last topic I have for you is we did get a call from a community member this week who got a phone call from someone claiming they were with the Washington Health System, and they spoofed our phone number. So when on the caller ID, it appeared as if it was coming from us when it really wasn't. Now, thankfully, this citizen knew that this wasn't us and that nothing happened. But we're concerned that someone might be out there spoofing and acting like us to try and scam you out of money, time, or resources. So please be very careful. During COVID-19, there are people out there trying to take advantage of all of us through telephone and email and other things. Please, please be careful. Lastly, I just want to thank you for your time and support. I hope you found this video helpful. We'll do the next one April 24th, next week Friday. Hopefully you'll be back for that. Until then, goodbye.